Good morning, Mrs. Swift. How are you? Good? Okay, that's good to hear. So I'm Vanessa Rico, and I will be your nurse today. I'm going to be performing a CVAD dressing on you, also known as a central venous access device, and you might know it as a big IV on that. Okay, so let me quickly check your wristband to make sure you are the right patient. Okay, Allison Swift, January 9, 2003. Okay, perfect. That matches my record and matches your ID band. Okay, do you have any allergies to chlorhexidine or maybe leg text? No? Okay. Do you have any pain at all? No. Okay. And have you had this procedure done before? No. Okay, so I will explain all to that. Okay, so a special thing about this procedure is that both of us have to be wearing masks. So I have my mask on, and I will hand you a mask before I remove the dressing, okay? Another thing I will ask of you is to turn your head to the left. And it is important because we want to prevent any sneezing, coughing, or any of that sorts from getting onto the IV site, okay? So I will start off by cleaning the surface for 30 seconds and then letting it dry for 2 minutes. Once it's fully dry, I will go ahead and grab my supplies, hand you a mask. Then I will start by removing the dressing and the blue patch, also known as the bio patch. Once that's all removed, I will go ahead and begin the sterile process, grab sterile gloves, and I will go ahead and clean the site with chlorhexidine, the foam brush, for 30 seconds, letting it air dry for 30. Once that's all nice and clean, I will go ahead and put on a brand new bio patch and put on a brand new dressing, okay? Everything's fine, Mrs. Swift? Yes, okay. Do you have any questions or any concerns about the procedure? No, okay, and you said you're in no pain, right? Okay. So I'm going to go ahead and perform hand hygiene. And I'm going to be doing this for 20 seconds. So 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20. Okay. Go grab a pair of gloves. Okay, perfect. Grab the other pair. Okay. I'm going to go ahead and wipe down the table for 30 seconds. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Okay, I'm going to go ahead and throw this away, as well as my gloves. And then I will be performing hand hygiene again. Now that I performed good hand hygiene, I'm going to go ahead and grab my supplies, okay? Are you doing all right, Mrs. Swift? Yes? Okay. I'm going to go ahead and put my bio patch down, my Sorbiview, and then I'm going to carefully open up my CVAD dressing thingy. So I'm going to go ahead and carefully remove my gloves, and I have this mask here for you, Mrs. Smith. Okay, I'm going to go ahead and turn you around, and I'm going to go ahead and carefully drop my supplies in. So I dropped the bio patch in, and I'm going to go ahead and carefully drop in the Sorbiview. Okay, that all seemed to have went well. Okay, I'm going to go ahead. Now that I got the supplies out, I'm going to go ahead and perform hand hygiene and glove. Okay? I'm going to go ahead and start the removal of your dressing, okay? And so the dressing is like a little band-aid, so it's a little sticky and you might feel some discomfort, but it shouldn't hurt at all, okay? Do you have any questions before we begin or any concerns? No? Okay. Let me know if you feel any pain, okay? So I'm going to go ahead and stabilize the catheter while carefully removing the dressing. An important thing to notice, to keep in mind of when performing this. Oh wow, it's very sticky. Okay, is to make sure when you're close to the bile patch, you want to make sure that you don't put pressure directly onto the site of insertion. You can put your fingers around, like on the sides of the bile patch, but you never want to press right in the middle, as that's where the insertion of the catheter is. This is very sticky. Okay. I will go ahead and put the dressing right here. We'll throw it away. Right after, it's just very sticky. I'm gonna actually throw it. Okay. And then I'm gonna carefully grab the bile patch and throw that away too. Okay, now that the dressing is off, I'm gonna quickly inspect it. So there isn't any redness, there isn't any signs of infections, there isn't any kinking or twisting or leaks in the tube, and the marker is still at 20, which is where it was before, and it matches the documentation from last time. Okay, so now that I've inspected for infection or anything, I'm going to go ahead and remove the gloves, and I'm going to go ahead and perform good hand hygiene. Now that I've performed good hand hygiene for 20 seconds, I'm going to go ahead and begin the sterile process, okay? So I'm going to go ahead and open my sterile gloves, making sure to only touch the 1-inch fold. Are you okay, Mrs. Swift? Okay. I'm going to go ahead and start with my left hand. These are very tight. Oh wow. These are very, very tight. I want to make sure I don't accidentally touch the outer. Okay, I'll fix the cuff after. I'm going to carefully insert my hand. Okay, I'm going to go ahead and fix the cuffs. Okay, this is folded in, but that's fine. Go ahead and remove this. Okay, and then I will carefully grab a gauze. I will not grab a gauze. My bad. I will first, actually, yes, I will grab a gauze. I'm going to crack the chlorhexidine. I'm going to clean for 30 seconds. So 1, 2, 3, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, 31, 30. I'm going to wipe. Now that this is all done, I'm going to go ahead and discard that. Okay, now I will let it dry for 30 seconds. So 1, 2, 3, 4, 5, 6, 7, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 5, 26, 27, 28, 29, 30. Okay, I'm gonna carefully grab the bio patch like a taco and insert it in. Okay, I will put this down. Okay, and then I'm gonna carefully grab the Sorbivia. Okay, so I'm gonna make sure it's applied. Okay. So I already performed a stress loop, and I'm just trying to make sure and put this in. Okay, the dressing appears to have been, just need to press down on the edges. Go ahead and throw that away, and I'm going to remove the backing. I'm going to go ahead and grab, I can throw this away now. I'm going to go ahead and grab this little sticker. I'm going to grab a pen, grab the date of today, my time, and my initials. I'm going to go ahead and place this down here. Okay, and then I'm also going to put the hub guard, also known as the pants, and I'm going to attach it over here. Okay, now that it's all stuck on there, I'm going to go ahead and lastly grab this piece of tape. And secure the catheter. Okay, now that I have applied the tape with the initial date and time, I will go ahead and remove my gloves and perform hand hygiene for 20 seconds. One last time. Okay, now that I performed good hand hygiene for 20 seconds, I'm gonna go ahead and turn you around, Mrs. Smith. We are done with the procedure. I'm gonna go ahead and remove your mask. Throw that away. And then perform good hand hygiene. Okay? Then I'm gonna, so are you having, how was the procedure? Was it fine? Did you have any discomfort or anything? No? Okay, perfect. Okay, I'm gonna go ahead and go now and leave you to it. So I'm going to go ahead and document that the patient tolerated the procedure, there were no signs of infections, and that the catheter length stayed exactly as where it was before in the last documentation. Okay? Okay, have a nice one, Mrs. Swift. Thank you.